Welcome back to CTV Morning Live. Bell Let's Talk Day. Let's Talk is the message we're trying to send, and we're trying to get the resources and the funding back into those that can help. Your text messages sent, both texts and long-distance calls, as well as your tweets made using the hashtag Bell Let's Talk. 5 cents going to mental health and to the funding, a part of Bell Let's Talk Day. And we are going to be bringing you tons of information throughout the course of the day as to why it's so critical, why it's important, and where the funds will be going. Joining us now from the Royal Ottawa, the Director of Youth Outpatient Psychiatry is Dr. Gail Beck. Great to have you here. And it is going to be a very busy day for you, but something that you have really been looking forward to.
We have been looking forward to it. We think that the message that it's important for people to talk about mental illnesses is tremendously important. This is very prevalent among young people, mental illness, and it's important that we talk about it so that they can get the help they need.
As we were talking prior to, you were saying being able to deal with it at a young age, because these are characteristics that will carry on, you know, through a lifetime in terms of it affecting them as adults.
Just like any illness, the sooner you get treatment, the better it is. The better your productivity is, the less likely you are to leave work. And we know that disability due to mental health is the most common cause of disability in Canada right now. And every day in Canada, 500,000 Canadians miss work because of a mental illness. And 40% of those Canadians have had that illness since they were under 18.
It's something that we have, especially in the last 2 years, there's been so much more discussion about it. There's been an openness. There's been the stigma has slowly, you know, we're definitely making a huge dent in that. And with that, more people are coming to you, more people are talking about it, and then there's the reality of what happens because the services, the resources are still not there.
Yes, we're having I would say that in the last 2 years, we know that our referrals to outpatient psychiatry have increased by 30%, but our resource base has not increased by that much. And it's as if we're asking for resources at the worst point in time financially, because we know how strapped governments are for funding. They are trying to make injections of funding, but there is no doubt we are not able to keep pace with the demand. And in many ways, we're pleased about that because it means that people are coming forward early.
It means that people are talking. It means that people are able to say and to look at family and friends and say, I need some help. What happens then? What will then happen if they run into a roadblock that there's waiting times? Or what's the information that we need to tell them right now? Hold on, wait, we're getting more things are happening?
Well, I think that people don't have to wait to see their family doctors. And we know that in the last several years, many more people have family physicians and have access to that kind of care. And many family health teams have access to mental health right within their teams themselves. So that means that there is some primary care, some frontline care for those conditions. Very often, that kind of care is enough. Very often in those teams, if they're getting some counseling, that may be sufficient. It is the wait list for more specialized care that is worrying, for those circumstances when the treatment isn't straightforward and simple, or when those treatments are ineffective. That is the place where we now need a further injection of funds, and that's why programs like Bell Let's Talk that raises money for that is so important to us.
And there's a positive outcome once people are able to discuss this, once they're able to kind of, this cloud hopefully, you know, is able to disappear. There's such a fulfilling life ahead once that you've dealt with the issues.
Absolutely. These are treatable conditions. We look after them all the time, and we see people getting better, often within a very short time. It's important that people get treatment.
And I was talking to you because, you know, recognizing Director of Youth Outpatient and Psychiatry, there are a number of different directors. There's a lot of work that's being done at the Royal Ottawa.
Yes, the Royal Ottawa is one of the premier institutes in Canada for research and treatment of complex mental illnesses. And we're seeing a lot of success in the treatment that we do, a lot of people very, you know, productive, right? Mm-hmm. Something that 10 years ago people didn't think about. They didn't think they thought maybe that they were weak because of having this condition, and we knew better then, and now they're beginning to realize that.
And breaking it down too, because you started to list them. So there's anxiety and that, you know, stress. There's a variety of different things that you can actually see and place and understand it a little bit better. In terms of how it is even broken down under the umbrella of the Royal Ottawa.
It is, and we know that there are investments. The federal government has recently invested millions of dollars into brain neurosciences research. They've made a big investment in a workplace health standard. So it is something that people are realizing and interested in, and it takes a lot of courage to speak about the fact that you've had treatment for a mental illness, different from speaking about the fact that you have diabetes. So these are very important initiatives.
It is, and it seems to have started with, you know, that people are already getting up this morning and understand what the day is about, and they're taking to the phones, they're taking to their tests, to the internet as well. So I know that you're going to be watching the numbers coming through, because each of those represents money that's coming back for services, for funding, and for research.
Well, we're back here this evening with the town hall, and I expect that will be very exciting to see what happens.
Good luck, and thank you for the work that is being done at the Royal.
Oh no, thank you for having me and for raising awareness.
Well, and we will continue to do that over the course of the morning, so please take the time, your text, your long distance call, if you're on the Bell Network, and share your tweets, use the hashtag BellLet'sTalk.